What if I told you that a natural habit most men are too embarrassed to mention could be your single most powerful defense against prostate cancer? Hello, gentlemen. I'm Dr. Christine Rodriguez, and welcome back to the Men's Vitality Hub. As someone who has dedicated over a decade to longevity and hormonal health, I'm here to tell you that masturbation after 50 isn't just a normal part of life. It is a clinically significant tool for your survival. We are diving deep into the prostate flush protocol, where we'll discuss how regular ejaculation can literally clear toxins from your system. I'm going to share a landmark Harvard study that tracked over 30,000 men and revealed a specific magic number of monthly ejaculations that can slash your cancer risk by 20%. Stay with me, because toward the end, I'll reveal the grip trap that many men fall into, which can actually damage your nerves, and I'll give you the exact frequency roadmap to keep your prostate healthy for the next 30 years. Before we get into the how-to, we have to address the internal stagnation risk that faces every man as he crosses the 50-year mark. Imagine your prostate as a small, specialized pump in a complex fluid system. Its primary job is to produce a zinc-rich fluid that nourishes and transports sperm. Now, imagine what happens to a pump if the fluid sits there, unmoving, for weeks or months at a time. In the medical world, we call this prostatic stasis. When the fluid becomes stagnant, it can become a breeding ground for chronic inflammation and microcalcifications. This isn't just a theory, it's a biological reality. This stagnant environment creates a toxic biofilm that can irritate the surrounding tissue and, over decades, contribute to the cellular mutations we call cancer. By practicing regular ejaculation, you are essentially flushing the pipes, ensuring that the cellular environment remains fresh and oxygenated. This is the hidden risk of the use it or lose it rule. If you aren't clearing that fluid, you're leaving your prostate in a state of high-pressure congestion. Still with me? That shows you're serious about your vitality. Let's look at the Harvard 21 frequency rule. This is one of the most robust pieces of data we have in urological history. Research has followed nearly 32,000 men for almost 2 decades. They found that men who ejaculated 21 or more times per month, whether through partnered sex or solo masturbation, had a 20% lower risk of prostate cancer than those who only did it 4 to 7 times. I want you to think about that. A 20% reduction in a life-threatening disease just by engaging in a natural free activity. But here's the micro cliffhanger that most men miss. It's not just about the number. It's about the consistency. Your prostate needs a rhythm of renewal. When you hit that frequency, you are signaling to your body to keep the tissue turnover active and healthy. Long-term, this doesn't just protect against cancer, it can actually help manage the symptoms of BPH, enlarged prostate, by reducing the physical pressure within the gland. Now let's discuss the vascular exercise effect. Achieving an erection is, at its core, a cardiovascular event. It requires your heart to pump blood into specialized chambers, and your veins to lock that blood in place. As we age, the tissue in the penis can undergo disuse atrophy. If the blood vessels aren't regularly expanded, they begin to lose their elasticity, like a rubber band that's been sitting in a drawer for years. Masturbation acts as a gym session for your vascular system. Every time you achieve an erection, you're flooding the tissue with oxygen-rich blood, which helps maintain the health of the smooth muscle cells. For my patients over 60, I often say that masturbation is physical therapy for your intimate health. It keeps the biological circuitry primed so that when you are with a partner, the system is ready to perform. Still with me? We're entering the safety zone where we talk about the lubrication law. This is the most common mistake I see in my clinic. Men over 50 have thinner, more delicate skin due to a natural drop in collagen and systemic moisture. If you are masturbating without adequate lubrication, you are creating micro-trauma. These are tiny tears in the skin that you might not even see, but they trigger an inflammatory response. Over time, this inflammation can lead to Peyronie's-like scarring or a loss of sensitivity. Imagine trying to run a high-performance engine without any oil. Eventually, the friction will destroy the parts. Always use a high-quality water-based lubricant to protect your tissue. This isn't just about comfort, it's about preserving the nerve endings that allow you to experience pleasure. True vitality is found in the joy we give to others and ourselves. We also have to talk about the neurochemical reset. When you reach climax, your brain releases a cocktail of calm, oxytocin, dopamine, and prolactin. For a man dealing with the stresses of a career, family, or aging parents, this is a biological emergency brake. Oxytocin, in particular, lowers cortisol, the stress hormone that is a known killer of testosterone and heart health. I've seen patients who struggled with chronic insomnia find relief simply by incorporating this natural reset into their bedtime routine. The afterglow isn't just a feeling, it's your nervous system shifting from fight or flight into rest and digest. Still with me? Let's move to the grip tension trap. As sensitivity naturally declines with age, many men subconsciously increase their grip pressure. We call this death grip syndrome. While it might help you reach the finish line in the short term, it creates a dangerous feedback loop. You are essentially numbing your nerves to normal levels of stimulation. I want you to imagine your nerves are like a fine-tuned musical instrument. If you play it too hard, you'll eventually break the strings. Instead of more pressure, focus on sensory variance, different speeds, different types of touch, and better lubrication. This keeps your brain's dopamine receptors sensitive and ensures you don't become dependent on intense friction to function. Next, we have to address the pornography feedback loop. In the digital age, it's easy to fall into a pattern where the brain requires high-novelty visual stimulation to trigger an erection. For men over 50, this can lead to PID, porn-induced erectile dysfunction. If your brain becomes wired to only respond to a screen, it can fail you when you're face-to-face with a real human being. I recommend a sensory fast for my patients who feel they've lost that connection. Try masturbating using only physical sensation and your own imagination. This rewires the brain to focus on the body rather than an external digital drug, restoring the natural bridge between your mind and your anatomy. Finally, we reach the BPH symptom management section. Many men find that irregular ejaculation actually improves their urinary flow. Why? Because an over-congested prostate is often an inflamed prostate. When the gland is swollen with stagnant fluid, it puts more pressure on the urethra, making it harder to empty your bladder. By following the 21 frequency rule, you are keeping the gland as lean and relaxed as possible. Think of it as a natural decongestant for your pelvic floor. A man's health is the true currency of his legacy. When you feel better physically, you show up better in every other area of your life. Imagine your life 6 months from now. You've let go of the outdated shame and guilt. You see your sexual health as a vital part of your longevity strategy, just like your diet or your exercise. You feel more relaxed, your prostate exams are coming back clear, and you have the confidence of a man who truly knows how his body works. This is the goal of the Men's Vitality Hub, to empower you with the science that others are too shy to share. If this session has given you a new perspective on your health, please hit that like button and join our community by subscribing to Men's Vitality Hub. We are building a brotherhood of men who prioritize evidence over embarrassment. I want to hear from you. Did you know about the 21 ejaculation rule before today? Or do you have questions about the biological why behind these benefits? Drop a comment below. I read every single one to ensure we're covering the topics that matter most to you. The strength of a man is built one disciplined choice at a time. Before you go, remember that while masturbation is healthy, it is not a cure-all. If you see blood in your semen, feel sharp pain in your pelvic floor, or notice a sudden change in your urinary stream, please see a urologist immediately. Those are warning lights on your dashboard that require a professional eye, but for the vast majority of you, the message is clear. Your body was designed for this activity, and your prostate depends on it. Take care of your health. Stay vital, and I'll see you in the next session to reclaim your power.